Thank you so much for the opportunity to talk about this project. So at the AAN, I presented a study that used a machine learning approach to forecast migraine attack based on detailed clinical symptoms and a rapid number naming test. So the reason why we were doing this study, or why we designed this study, was because for a lot of patients with migraine, they might frequently wonder, am I going to have a migraine attack soon? Or if they're already in a migraine attack, whether this migraine attack would continue. And currently, there's no accurate way to forecast whether someone will have a migraine attack or how long a migraine attack will continue. We did look into previously published studies, and there were several studies that had done, including machine learning approaches to forecast migraine attack. But those studies utilized symptoms or features collected once daily to predict migraine attack over the next day, with room for further optimizing the model performance. So the design of our study was to utilize detailed clinical symptoms and an objective measure, in this case, which is a rapid number naming test called the King-Devick Test. So we did the test multiple times a day, 3 times a day, and then designed a machine learning model that can forecast migraine attack over the next 6 hours rather than the next day, to kind of build this accurate machine learning models that can forecast migraine attack. So that is kind of the background and the goal of this study. Previously, we presented several studies, kind of our pilot study, to use this rapid number naming test, the King-Devick scores, and we found that there was a difference between the migraine attack phase and the interictal baseline, that the KDT score was slower during the migraine attack phase. So subsequently, we designed another study that we enrolled 30 participants and asked each individual to take a King-Devick score and also record very detailed symptoms that they are experiencing at the moment and which migraine state that they felt that they were in at that time. So we did that recording 3 times a day over a 4-month period. And because of that, from 30 participants, each subjects recorded daily 3 times a day for 4 months, we collected close to 5,000 data points. So that's why we use, with a sufficient amount of data, we kind of constructed this machine learning model to forecast migraine attack over the next 6 to 12 hours. So for our machine learning model approach, we kind of use a leave one out approach. So we use the data set from 29 subjects for model training, and then 1 subject as a testing, and then repeat this process for 30 times. Our results showed that we were able to build several quite robust machine learning models. So the overall model performance had an AUC of 0.66, like close to 0.7, which is the overall kind of performance of all these 30 models that we constructed. However, when we look at each individual models, our most robust models had an AUC in the test set of 0.95 and accuracy of 90%, like over 90%. Our top 4 models had accuracy over 90%. So that means that, for the models that we built, the top performing models had pretty high performance, had robust performance and high accuracy. So that was one important kind of conclusion of our study. Another important conclusion of our study is that we did the variable importance analysis. So we analyzed which features or variables were the most important for the model to make prediction of whether someone will have a migraine attack over the next 6 hours or not. And the most important variable we found that was kind of the current migraine state, the self-report migraine state that participant felt that they were currently at, time from last migraine attack, the several measures, different measures of the KD scores, and also the current health state, sleep state were very important. In addition, several symptoms that participants experience at particular states. So, for example, experiencing photophobia and phonophobia when they are having a prodrome phase, like premonitory or prodrome phase, or experiencing photophobia and fatigue during the migraine attack phase. Those symptoms were the most important for the model to predict whether someone will have a migraine attack over the next 6 hours or not. So I think those were the most important take-home message, that using detailed headache characteristic or symptoms a participant, someone is experiencing at the moment, plus an objective measure that was recorded multiple times a day, we develop a machine learning model that can accurately forecast whether someone will have a migraine attack over the next 6 to 12 hours, using a robust machine learning approach. We are planning to kind of prospectively validate kind of those most accurate models kind of in a prospective study to see how good this model perform. I also wanted to point out that that is the benefit of using AI or machine learning models to forecast migraine attack, because when we analyze our results from our previous studies or pilot studies, if we use a simplified approach, for example, just based on the KDT score alone, because there's a lot of fluctuation in the KDT score, even during a kind of interictal baseline phase, like when someone don't have a migraine attack, even there will be a fluctuation of the KDT scores that we observe for some subjects, that the KDT score will continue to go up with time or go down with time. So like a simplified approach, like using a KDT score alone, even during a premonitory phase or prodrome phase, might not be accurate enough to forecast migraine attack. So that's why we decided to take this machine learning approach using multiple information. So we use baseline headache characteristic, demographic data, several questionnaires participant filled out at baseline, and this multiple data point, including objective symptoms, including self-reported symptoms, and an objective measure to construct this machine learning model that could yield the most accurate results. So I think the study also speaks to the importance of incorporating multiple aspects of data and using the robust machine learning models to forecast migraine attack, and rather than taking a simplified approach to see whether someone will experience a migraine attack.